Thank you for the opportunity to present our work. On behalf of my co-authors and the Michigan Society of Thoracic and Cardiovascular Surgeons Quality Collaborative, I will be presenting. Post-operative opioid prescribing policies after cardiac surgery have been extensively studied. And research in this area has led to increased scrutiny of prescribing policies, ultimately leading to decreased opioid prescribing. Post-operative opioid prescribing after cardiac and thoracic surgery has been one of the main quality improvement goals of the MST-CVS Quality Collaborative. Our research in this area has helped us understand how many opioid pills most patients require after cardiac surgery, and ultimately led to the development of post-operative prescribing recommendations. And yet we found ourselves wondering, does every patient require an opioid prescription after cardiac surgery? And if not, what characteristics do the patients who do not receive an opioid prescription at discharge have? Ultimately, we wanted to understand what are predictors of not needing an opioid prescription after cardiac surgery. To look at this, we studied opioid-naive patients, defined as not taking an opioid prescription at the time of admission for surgery, undergoing cardiac surgery at one of 10 centers that are participants in the MST-CVS Quality Collaborative from January through December 2019. Patients were excluded if they were a redo, were an operative mortality, had a post-operative length of stay longer than 30 days, or were discharged to a location other than home, such as rehab or skilled nursing facility. We collected patient demographics and outcomes data, as well as unique opioid variables that were primarily collected by data managers within our quality collaborative. The primary outcome was discharge without an opioid prescription. Mixed effects logistic regression was performed to identify predictors of discharge without an opioid prescription, incorporating patient demographics, comorbidities, operative acuity, operation type, and the random effect of each hospital. Among our 1,924 eligible opioid-naive patients, nearly 1/3 were not discharged with an opioid prescription. On multivariable analysis, older age, longer length of stay, and undergoing surgery during the last 3 months of the study period were all independent predictors of discharge without an opioid prescription. Conversely, history of depression, taking more opioid pills on the day before discharge, and non-Black and non-white race were all independent predictors of discharge with an opioid prescription. While we've identified patients who do not require an opioid prescription, but is this practice well tolerated? We found that among the nearly 600 patients who were discharged without an opioid prescription, 10 or less than 2% were prescribed an opioid after their discharge, but before their follow-up appointment. In our group, there were 900 patients who did not take any opioids on the day before discharge. Among these, about 500 patients did not receive an opioid prescription on discharge, but 400 patients who did not take any opioids on the day before discharge did receive an opioid on discharge. Were these 400 prescriptions necessary, or were they prescribed just in case? In conclusion, not every patient will require an opioid prescription after cardiac surgery. In select patients, discharge without an opioid prescription is extremely well tolerated, with the vast majority of patients doing well without requiring any opioids at home. These data suggest that we may reconsider providing patients with an opioid prescription just in case they may end up needing it. And we should continue to consider the level of opioid use during a patient's time in the hospital to guide prescribing at discharge. Thank you again to the Society for featuring our work. Questions and comments may be directed to me by email, and I can also be reached on Twitter.